everyone, my name is Miranda and I'm going to be telling you about physician-assisted suicide today. So for my case study, I actually did two separate cases. I have the case of David Rivlin, which happened in the 1980s, and then I have a case of Brittany Maynard, which happened in 2014. So first I'll talk about Rivlin. Rivlin was 38 years old and he lived in Michigan. When Rivlin was 20, he suffered a surfing accident in California and was paralyzed from the waist down. Now, many of you would think that that is not that big of a dilemma, that he didn't have that big of a disability, just being paralyzed from the waist down. You know, he's still mobile and he could still get around in a wheelchair. However, when he was 23, he had a spinal aneurysm up on his C7 vertebrae. When he'd had surgery, there was a complication and he was actually paralyzed from the neck down. After that, Rivlin was sentenced to a nursing home where he lived the rest of his life on a ventilator, having round-the-clock care by nursing staff, doctors, hospitalists, you name it. When Rivlin was 38, he decided it was time to petition the courts in Oakland County, Michigan, to go through with a physician-assisted suicide case. Rivlin won his case when he was 38 in 1989, but the courts ruled that it would be a simple refusal of treatment. It would not be considered physician-assisted suicide. It would only be considered a refusal of treatment since Rivlin was not terminally ill. The courts thought that since Rivlin could possibly live out another 30 to 40 years, that he would not be considered for physician-assisted suicide since he did not have a terminal illness. Now, Rivlin's doctor was allowed to prescribe him a dose of Valium, which is an anti-anxiety, and then a dose of morphine, which is a very strong opioid, it's a painkiller, to proceed in his death. On the night Rivlin decided he wanted to go through with the physician-assisted suicide, he contacted his doctor. His doctor administered the Valium and morphine and simply took him off the ventilator. 5 minutes later, Rivlin was pronounced dead. This all happened in 1989. Now we fast forward to 2014 with the case of Brittany Maynard. Maynard was 29 years old and she was a teacher living in California. Now Maynard was diagnosed with a grade 4 glioblastoma, which is a deadly brain tumor. Maynard decided that she did not want to go through with treatment because she was terminally ill. There was no treatment involved for her brain tumor. So she moved to Oregon to take advantage of the Death with Dignity Act. Now Maynard decided to end her life on November the 1st of 2014 by taking a lethal dose of morphine that was prescribed to her by her doctor. She died surrounded by family and loved ones that night. But before she died, Maynard decided she needed to advocate for patients' rights on physician-assisted suicide. There is a website called thebrittanyfund.org where it shows her story, and she also partnered with Compassion and Choices, and she has a section dedicated to Brittany Maynard called compassionandchoices.com/Brittany Maynard. Today there are 10 United States jurisdictions, including Puerto Rico and several states in the continental US, that have a form of legal physician-assisted suicide. So because of this, because of Maynard's advocacy, California now has a physician-assisted suicide law that was put into place because of Maynard. But you have to think, are there ethics involved with this? Well, of course, it's physician-assisted suicide. So we'll talk about David Rivlin first. Rivlin's case was considered a refusal of treatment and that no malpractice and wrongdoing was done by his doctors or nurses or hospital staff or anybody involved. However, he was not offered any sort of psychological counseling or evaluation prior to his court ruling. Rivlin was considered mentally competent and he was allowed to do as he wished. And then the question comes up, did David Rivlin make the decision to die based off of the fact that he was depressed because he was living in a nursing home with a ventilator? Did he try to spare his family the cost of palliative care, which even in the 1980s was very expensive? It cost well over $600 to keep Rivlin in a nursing home funded by Medicaid. So Rivlin's case actually was the first of its kind to kind of push lawmakers and get the ball rolling according to physician-assisted suicide. So next we'll talk about Brittany Maynard's case. She was offered psychological counseling, but she denied it. And so it raises the question of, should a patient be required to go through with at least one session with a psychiatrist or a psychologist in order to determine whether they know what is happening? And Brittany's case is that a patient or physician should not decide when somebody dies. That should only be a decision made by God or an holy entity. But even if it was to relieve pain and suffering, some people believe that that is not the decision of mankind to make. Today, in 2020, we have 10 United States jurisdictions with some form of physician-assisted suicide available. But the thought is, if physician-assisted suicide became legal throughout the United States, would there be a requirement to have psychological counseling for patients, and that it wouldn't be just to solely determine whether the patient was mentally competent and able to make their own decisions. It should be whether the patient is ready to die. But ultimately, if a law were passed in the United States for physician-assisted suicide to be legal in some form, it could end pain and suffering for a lot of people. Thanks.